Hello, my name is Victoria Tomczak and I'm the stroke nurse navigator for Hoag Hospital, and I was invited here today to speak to you about how to prevent a stroke. So we hope that by your participation with this education event today that we can help you become a little more stroke smart. And how do we do that is we know the 3 R's of stroke, and that's how to reduce your risk of having a stroke, how to recognize stroke signs and symptoms, and then how to respond at the first signs of a stroke, and that's by calling 911 immediately. And if you have any questions throughout the presentation, feel free to put them in the chat, and then I will get those questions and I'll answer those for you. So what is a stroke? So a stroke is a brain injury, and it is caused when a blood vessel to the brain becomes blocked by a blood clot, or it bursts, and that cuts off blood flow and oxygen to the brain tissue, and that causes what we call a stroke. So 87% of all strokes are caused by a blockage in a blood vessel, and the other 13% are caused by bleeding in the brain. So in the US, about every 40 seconds, someone suffers from a stroke. Yet, 80% of strokes are preventable. In fact, stroke is one of the most preventable of chronic or catastrophic medical illnesses that we can have. So knowing our risk factors for stroke can help us prevent a stroke. So there are some risk factors that we can't change. That's hereditary things, age, race, but there are many risk factors that can be changed, treated, or controlled so that you can prevent a stroke. So the best thing to do is talk to your doctor about your stroke risks. So some of the stroke risk factors that we can't control is our age. The likelihood of having a stroke nearly doubles every 10 years after the age of 55. And although strokes seem more common among the elderly population, a lot of people under the age of 65 also have strokes. And actually anyone can have a stroke, even children. A family history of stroke can raise your risk for having a stroke. So if your parents, grandparents, sister or brother has had a stroke, especially if they have that at a younger age, before the age of 65, that increases your risk of having a stroke in your lifetime. Race can make a difference. Statistics show us that African Americans have a higher risk of having a stroke, and they also have a higher risk of death from a stroke. And Hispanics and Latinos also have some unique risks for stroke, and that's usually high blood pressure, diabetes, things like that. Gender can affect your risks for having a stroke. Each year, more women than men have strokes. Before the age of about 65 or 70, more men have strokes, but then it flips. As we get a little bit older, the risk for women goes up higher. And did you know that twice as many women die from a stroke than die from breast cancer? Yeah, everyone is more aware of breast cancer, and there's a lot less awareness about stroke in women. So what are the things that predispose a women to having strokes? Is pregnancy, history of having preeclampsia or eclampsia, or gestational diabetes are risks for stroke later in life. Oral contraceptive use, especially when it's combined with smoking, and postmenopausal hormone therapy are all factors that can increase your risk of having a stroke. So be sure to discuss your specific risks with your doctor. Having a prior stroke or a transient ischemic attack or even a heart attack can raise your risk of having a stroke. So a person who's had a stroke has a much higher risk of having another stroke than a person who has never had one. Transient ischemic attacks, or sometimes called TIAs, or you might hear it referred to as a mini stroke, these are also strong predictors of having a stroke. TIAs are smaller, temporary blockages in the brain that can produce a milder form of a stroke. but it doesn't leave permanent damage to the brain. But I like to call a TIA not a mini stroke, but I like to call it a warning stroke, because it's a warning that a big stroke could be about to happen. So TIAs are very important to pay attention to those symptoms and get medical care right away, because what we want to do is prevent that big stroke from happening. So having a prior heart attack also increases your risk of having a stroke. A heart attack is a plaque buildup that causes blockages in the blood vessels to the heart. And similarly, most strokes are caused by buildups of plaque that cause blockages in the brain. So the things that put us at risk for heart disease also put our brain at risk for stroke. So now let's get to the fun part. What are the things that we can do to control, treat, and improve in order to prevent a stroke from happening? Number one, the most common risk factor for stroke in the world is high blood pressure. So managing your blood pressure, making sure your blood pressure stays within a healthy range by working with your doctor, you can reduce the strain on your heart, the arteries in your entire body, your kidneys, and that helps keep us healthier longer. So a normal blood pressure, according to the American Heart Association, is 120/80 or lower. So what do we do about our blood pressure? Okay, so normal blood pressure, if it's 120/80, they recommend that you live a healthy lifestyle, eat a healthy diet, exercise, things like that, and get your blood pressure checked annually. If your blood pressure is a little bit elevated, say 120/130, and the bottom number is still 80 or below, they still recommend healthy lifestyle changes, but you should get your blood pressure rechecked in 3 to 6 months. Now, if your blood pressure is high, so that's the top number is between 130 to 139, and the bottom number is above 80 to about 89, they recommend that your doctor does a 10-year heart disease and stroke risk assessment. And if your risk is less than 10%, that they recommend healthy lifestyle changes, but get your blood pressure rechecked every 3 to 6 months. If it's higher than 10%, then they do recommend starting medications to get your blood pressure into a normal range. And then if your blood pressure is very high, that's above 140/90, American Heart Association recommends lifestyle changes, maybe 2 types of different blood pressure medications, monthly follow-up with your physician until your blood pressure is well controlled. So the key is checking your blood pressure, number one. Number two is working with your physician to make sure it's controlled and that it stays controlled. The next risk factor that we can change and control to prevent stroke is diabetes. Having diabetes more than doubles one's risk of having a stroke. So many people with diabetes also have high blood pressure, high cholesterol, and are overweight, and this increases your risk of having a stroke even more. So about every 2 minutes, an adult with diabetes in the US is hospitalized for a stroke. So the key is to work with your doctor to manage your diabetes and therefore reduce your risk of stroke. So for diabetes management, they recommend that your hemoglobin A1C is below 7 to actually have your diabetes controlled and reduce your risk of stroke. But we even shoot for lower than that if we can. Okay, the next risk factor that we can completely control is high cholesterol. So high cholesterol increases our risk of blocked arteries, and that's the blocked arteries to the heart, blocked arteries to the brain. And if the artery to the brain is blocked, that's when a stroke can occur. So the most common thing that we can do to lower our blood cholesterol is to eat a healthy diet. So eat foods that improve your heart and your brain health. So diets that are high in saturated fats, trans fats, and cholesterol can raise our blood cholesterol levels. Diets that are high in sodium or salt can increase our blood pressure, and high calorie diets can lead to obesity. So what do? We eat a diet that's rich in vitamins, fruits and vegetables. We want monounsaturated fats or polyunsaturated fats, so things like olive oil. Those help decrease the production of the blockages in our blood vessels. Diets that are high in saturated fats, those are things like meats and cheeses and high-fat dairy products. Those are the things that raise our cholesterol. And just so you know, some people can have high cholesterol without ever eating a drop of fat in their diet because they have a hereditary risk for high cholesterol. So those are people who really need to work with their doctor to get their cholesterol levels under control, and that usually requires medications. But a lot of things that we can do every day, healthier diets, even increasing our exercise can help reduce our cholesterol levels. Okay, physical activity is a strong deterrent for having a stroke. So if you're physically active or physically inactive, you need to start moving and be more active. And you know, a lot of us have physical limitations, and that's okay, because even just walking, for 30 minutes every day can really decrease our risk of having a stroke. It helps our heart health, it helps our brain health. So being physically inactive increases not only our risk of stroke, but heart disease. It leads to becoming overweight, developing high blood pressure, high cholesterol, diabetes. So I think you can hear there's a lot of things repeating here. A lot of things are related. So just making some small changes can actually impact our overall health, along with decreasing our risk of stroke. Okay? So go on a brisk walk. Take the stairs instead of using the elevator or the escalator. And do whatever you can to make your life a little bit more active. If you can get 30 minutes of activity on most days of the week, that can really reduce your risk of stroke and heart disease. Any questions so far? Awesome. Hopefully I can read it. Okay, so the question is about blood pressure, what does the bottom number mean? Is 59 to 65 good? Actually, yes, that's a good number for the bottom number in our blood pressure. So just to explain what the two numbers mean, the top number is the pressure in our vessels when the heart contracts. So when it squeezes the blood and it goes out to our body, that's the pressure in our vessels. The bottom number is what they read when the heart relaxes. So as the blood is coming back to the heart to go to the lungs and get reoxygenated and then get pumped out again. So when the heart is relaxed, actually we want that number to be a good healthy number, because if it's a higher number, that means there's stress on your vessels all the time. So the higher the bottom number, that means you have high pressure in your vessels even when your heart is in a relaxed state. So I hope that answers that question. So yes, 59 to 65 is a good number for that bottom number. Okay? So the next thing that we can do to help prevent a stroke is maintaining a healthy weight. So if you're overweight, we want to start taking steps to get your body mass into a healthy range. So when we look at our body mass index, a normal BMI is about 18 to 25. Between 25 to about 30 is considered overweight. And the obese category is a BMI of 30 to about 40. And then morbid obesity is a BMI of over 40. So excess body weight and obesity are linked to increased risk of high blood pressure, diabetes, heart disease, and stroke. Again, we're repeating these things. So we can see that a lot of these health conditions go together. And how they calculate your BMI, your body mass index, is a combination of your height and your weight taken together. And then there's a calculation that is done to determine what our body mass index is. Okay? Smoking, using smoking, vaping, smokeless tobacco, all of those are bad for our health. There's a lot of studies that confirm that cigarette smoking is a crucial risk factor for stroke. The nicotine and carbon monoxide in cigarette smoke damages all of the blood vessels in our body, and it paves the way for a stroke to occur. And we say that vaping is a risk for stroke because guess what? Most of those vape juices, or whatever they call it, they contain nicotine, and so it has the same effects in our body as smoking a cigarette. And then also smokeless tobacco contains the nicotine, so that's a risk factor for stroke. Okay, atrial fibrillation, or a lot of us hear it called AFib. That is an irregular heartbeat, and it causes the heart's upper chamber, so the top part of the heart, it causes it to quiver instead of beating in a normal organized rhythm. Okay, so this increases our risk of stroke by about 5 times because the fluttering in the heart causes the blood to pool. And when the blood is pooled or not moving, that can cause a clot. And then when the top part of the heart decides to have a normal beat, it can send those clots up to the brain. So if you have AFib, you need to know your risks for stroke. And the best way to do that is to talk to your doctor. Your doctor will take a look at your AFib. They also take a look at other things like age, congestive heart failure, if you have diabetes, if you've had a prior stroke or TIA. All of those things combined with AFib really can increase your risk of stroke. So that looking at all of that helps your doctor to decide what's going to be the best treatment to keep your risk of strokes low. Okay, so if anybody has a question about that, that usually does prompt some questions. And so the question is that I am 77 years old and diabetic. My last A1C was 7.3. Is that abnormal? Well, actually 7.3 is getting very close to where we want the A1C to be to reduce our risk of heart disease and stroke. So your doctor's probably shooting for an A1C of 7, so 7.3 is very close. So I just say continue working with your doctor, a few dietary changes, a little more exercise, maybe can drop that A1C down to that 7.0 range, but you're very close. So keep working on what you're working on. That's a good job there. Okay. So what's the next thing that we can control and help prevent a stroke? So carotid artery disease. So the carotid arteries are in your neck, and they are the primary blood vessels that supply blood flow to the brain. So when a carotid artery is narrowed by fatty deposits from atherosclerosis, or the plaque build up in our vessels from cholesterol, they can become blocked, and then a blood clot can get stuck in that area, and that will block blood flow to the brain. And because they're located so close to the brain, carotid arteries may more easily cause a stroke, but an artery disease may contribute to a stroke. Okay? So sometimes those plaques that are built up in the artery, actually, instead of a blood clot getting stuck there, a little piece of that plaque can break off and go up to the brain, and it actually causes a stroke. So it's not only a blood vessel or a blood clot that can cause a stroke. It can be those plaques that become fragile and pieces can break off. So if you have carotid artery disease or any other artery disease, it's good to get treatment to lower your risk of stroke. And that's, working with your doctor to get those conditions treated. Okay. What's the next thing that we can do to help prevent a stroke? Okay, I think we got another question. So, how do we reduce plaque? That's a really good question. So once the plaques are forming, it's sometimes difficult to reduce them. But what we can do is by controlling our cholesterol and working with our doctor to get on the right medications, what we can do is we can prevent those plaques from getting worse over time. But sometimes with good management of cholesterol and the right medical treatment, we can see those plaques at least become stable and smooth instead of rough and crystallized. When the cholesterol sticks to those plaques in our vessels, it becomes very hard, and it's a rough, bumpy surface, and cholesterol can cause crystals to stick on the plaques. And what happens when that occurs is the blood flowing through the vessel is not flowing smoothly. So you think of your blood flow going up to your brain like you're drinking something through a straw. It flows nice and smooth. But if you pinch the straw, the blood flow doesn't go through right, and you sometimes feel it bubbly, or so the blood is going wavy over that, and that can be a risk for causing strokes because the blood will swirl in those little areas. So good treatment, lowering the cholesterol and getting those plaques to stop building up can make them smoother, and that way the blood can flow through the vessels a little bit easier. Does that answer? Hopefully that answers the question. Because, you know, that's not just in the vessels to our brain. That's the same thing that occurs in the vessels of our heart, creating heart disease and putting us at risk of heart attacks. It can happen in the vessels of the legs. You know, we have some people that have peripheral artery disease. A lot of times it's caused by the same thing. So getting the cholesterol controlled can really help our blood vessels throughout our bodies. Okay. So another thing we can do to help prevent a stroke is to stay hydrated. Dehydration has been linked with inflammation, artery stiffness, blood pressure regulation, and other factors that can raise our risk of heart disease and stroke. So drinking water throughout the day is one of the most effective things that you can do to improve your health and well-being and prevent a stroke. When we get dehydrated, our blood tends to get just a little bit thicker and maybe a little bit stickier, and that's when those small blood clots can form that can lead to a TIA or a stroke. So I'm not saying you have to guzzle gallons of water every day, but getting a few extra cups of water every day can help us with our hydration. And did you know that as we get older, our sense of thirst isn't as keen as it is when we're younger? You know, when you're a little kid running around playing outside and you're hot and thirsty, you'll even grab the garden hose and drink out of it because you're thirsty. But as we get older, we don't really sense that we're thirsty until we're already getting dehydrated. So just, you know, drinking water throughout the day is a good way to help prevent stroke and keep us hydrated. And drinking alcohol. Alcohol can be a dehydrator. It causes us to urinate more, so you're losing more fluids. And according to the U.S. dietary guidelines that were published for 2015 to 2020, which I'm sure they've come out with new ones now, and I'll have to look into those, but people should really limit their alcohol-related risks by drinking alcohol in moderation. So what that means is up to 1 serving per day for women and up to 2 servings per day for men. And a serving would be considered 1 beer, a 5-ounce glass of wine, or 1 little 1.5 ounce of liquor. But of course, you know, drinking alcohol, if you're diabetic, it's just like you might as well eat sugar cubes because it just converts to sugar in our bodies very easily. So people who are diabetic really should try to avoid alcohol because it really does increase your blood sugar. Okay. So what's another thing that we can do to prevent stroke? Getting restorative sleep. Good sleep benefits our whole body, including your heart and your brain. It affects our mood, it affects our memory and our reasoning. And when we're rested, well rested, we just do better all day long. So another risk for stroke we have found is that sleep-related breathing problems. So you might hear it called sleep apnea. That's when people stop breathing during their sleep. That really puts us at risk for stroke, because what that does is it increases our blood pressure in our brain all throughout the night. And so we know that high blood pressure wreaks havoc on the blood vessels of the brain, increasing our risk of stroke. So this little picture, actually, it has something underneath it I like. It says hashtag snored to death. So sleep apnea hurts hearts, and so that it's a risk for H is for heart failure, E is elevated blood pressure, A is actually a risk for AFib, R is resistant hypertension, so it makes your hypertension harder to treat, T, type 2 diabetes, and S is a risk for stroke. So if someone tells you, my gosh, you snore like a freight train, or someone has to smack you during the night to wake you up so that you start breathing again, that is time to see your doctor and get referred for a sleep study. What they do during a sleep study is they hook you up to some monitors. They monitor your oxygen, they can monitor your brain waves, and they actually can monitor your limbs, because some people's limbs move all night long, legs and arms kick. And that can tell us if you have periods of when you stop breathing during your sleep, how low is your oxygen level going, and is it affecting the brain waves? And that helps your doctor to prescribe you treatment for sleep apnea to prevent your risk of heart disease and stroke. So if you are someone that snores a lot, it's time to get checked out by a sleep specialist. Okay? And so remember that 80% of strokes can be prevented. That's a huge number. When you figure that about 795,000 people every year have a new or recurrent stroke, preventing 80% of those could really save lives and save your well-being. Most strokes today aren't deadly, but strokes are the highest risk for long-term disability in adults. So really paying attention to those stroke risk factors, doing what you can to control, treat, and improve your risk factors can help you stay healthy. So how do you keep your stroke risk low? Regular checkups with your doctor. Treatment for any of those conditions we just talked about, especially high blood pressure, diabetes, and high cholesterol. Getting those things treated can help prevent strokes. Okay, any questions about stroke prevention? So now I want to move on to the next thing that we need to know. Not only reducing our risk for stroke, but how do we recognize the signs and symptoms of a stroke? How do we know if someone is having a stroke? And then we'll talk about how do we respond to someone who's having a stroke. And right here on this slide, it's there's a little hint. Call 911 immediately. So we'll talk a little bit more about that. Okay, stroke, signs and symptoms. When we think about stroke, we want to B fast, okay? B stands for your balance. Is there a sudden loss of balance or coordination? You're suddenly, you're trying to reach for something and you're missing it. That can be a warning sign. And these come on suddenly. Stroke happens immediately. You're normal 1 second, you're not normal the next second. Okay? So E stands for your eyes. Is there a sudden loss of vision in one or both eyes? Or a sudden change in your vision? Sudden double vision? These can be signs of a stroke. F stands for your face. Is there an uneven smile, drooping of one side of the mouth, drooping of one eye? Is the forehead drooping down? Even the eyebrow can droop down when someone's having a stroke. A stands for arms. Is one arm weaker than the other? This can also apply to the legs, but the most common area for strokes will affect the arms. So that's why we usually look at the arms first. S stands for speech. Is there a change in the person's speech? Is it suddenly slurred? Are they suddenly unable to speak? Are they unable to understand speech? Or they know what they want to say, they just can't get the words out. These are signs of a stroke. And T stands for time to call 911. Okay? So again, B fast. Balance. E is eyes. F is face, drooping in the face. A is arm weakness or numbness. You can ask the person to raise both of their arms. If one side drifts down, that can be a sign of stroke. S is for speech. Slurred, can't speak, can't understand. You can ask them to say a simple sentence like, today is a sunny day. And if they can't repeat the sentence, that can be a sign that they're having a stroke. So call 911 if a person you're with, or even yourself, notices those symptoms. If you're by yourself and you think you might be having a stroke, if you call 911, even if you can't speak to them, they're going to send someone to your house. They're going to figure out that if you're on the phone and nobody's saying anything, that there must be a problem, and they're going to send someone to your house. So even if you're alone, you can call 911. Okay, so we got to remember that the sooner a stroke victim gets to the hospital, the sooner they can get life-saving treatments, because every 4 minutes, someone in the U.S. is dying from a stroke. So I don't know that I actually have a slide about some of the treatments that we can do for stroke, but I'll just talk a little bit about those treatments here. We say that time is brain. So when someone is having a stroke, knowing that when those symptoms started or when the person was normal last is important, because we only have about 4.5 hours from the time a stroke started to give what we call a clot buster medicine. So that medicine can go throughout the bloodstream and it will dissolve the blood clot that's causing the stroke, and it can restore blood flow to the area of the brain, therefore even sometimes completely reversing the symptoms of a stroke, and we see that often. There's also another type of treatment that can be done to treat a stroke, and that's if there's a blood clot lodged in a large vessel of the brain. So we call it a large vessel occlusion. There's a procedure that can be done where they take a catheter and they go through the groin or through a blood vessel and the wrist, and they go up to the brain, and they actually can remove the blood clot from the vessel in the brain and restore blood flow. But again, with that procedure, there's only a limited number of people who actually have a large blood clot. Like we said, most strokes are caused by plaques and small, clots in the small vessels of the brain. But those large vessel occlusions can cause devastating strokes. So we want to get those people for that procedure right away. So again, the sooner you call 911, the better our chance of recovery. So time is brain when we're thinking about stroke. Then I just wanted to mention a little bit about stroke and COVID-19. So when the coronavirus pandemic hit, a lot of people were afraid of coming to the emergency department for serious health conditions like heart attack and stroke. And according to the American Heart Association, the risk posed by ignoring heart attack and strokes are far greater than any risks posed by COVID-19 and by seeking health care. So I want everybody to know it is safe to come to the emergency department if you're having the warning signs of a stroke or chest pain or any serious health condition. We have screening processes in place that separate anyone that presents with symptoms of COVID-19. So if you come in through 911, everybody is screened. You'll go to a completely separate area of the emergency department, because we want people with strokes and heart disease to get the treatment they need. Strokes are medical emergencies and they need emergency care. So please don't be afraid to call 911. We would rather try and reverse your stroke than have you sit at home and let symptoms go on for days, because once it gets to that point, there's really nothing we can do to reverse the effects of stroke. Then it all becomes managing medical conditions and then stroke recovery, which is worse. It's harder if you've not gotten medical treatment right away. So I do want you to know that it is safe to get care for your emergencies. So if you call 911 for someone having a stroke, there's a few things they're going to want to know. They're going to want to know the last time you saw the person to be normal without stroke symptoms. So when is that? If you're with the person and you witness the symptoms occurring right in front of your eyes, which I had that happen with my grandmother. She had a stroke right before my eyes. But sometimes people will wake up with a stroke. They went to bed at 10 o'clock at night and they were fine. When they woke up at 6 in the morning, they had symptoms. So the last time we knew that person to be normal was 10 o'clock at night. Or you woke up and the person was fine, you left for work and you came back, and then at the end of the day they had symptoms. If that person can't tell you when their symptoms started, then it would be the last time you saw them in the morning. Or if you're with the person you witnessed the symptoms, then that is the time last seen normal. The paramedics are also going to want to know what medications is this person taking. And that's important because then we'll know if they have high blood pressure, if they're diabetic, taking diabetes medications, if they're on anticoagulants for AFib or some other health problem. That can affect our ability to give the clot buster medication. So having a list of their medications is good, or even grabbing their medicines and putting them in a bag so the paramedics can bring those to the hospital. We can look at those medicines, and those will be stored in the pharmacy and given back to the patient before they go home. But that way we have a complete list of their medications. They're also going to want a phone number. A cell phone number or the number of a family member. It's best if it's the number of the person that was with them or saw them last normal or has a lot of information about their health history, because when they get to the hospital, the doctors are going to want to ask questions. And right now, with the COVID pandemic, we're not allowed to have visitors in the hospital. So they really need good telephone communication with the family members so that we can figure out what is this person's risk factors for stroke and when were they last known to be well. So giving the paramedics that phone number is key. Okay, so the right care right away can make all the difference. It can save a life and it can save the quality of your life. Okay, and that's with stroke. We want to reduce those the disability that can go along with stroke. So call 911, get transported quickly to a stroke certified hospital. And Hoag Hospital is a certified stroke center. Okay, so that might be my last slide. So any questions about that? No? Okay, well, what else can I tell you about stroke that I didn't cover already? So, let's see. Yeah, pardon?
Just wrap it up.
Okay, well, if there's no further questions, I hope that the information that I provided for you today is helpful. And just knowing those warning signs of a stroke can really, make you able to help someone. You may even just be in the grocery store and see someone having those symptoms, and then you would know, just call 911. That's the key. And one thing I didn't mention is when someone has a TIA, or a transient ischemic attack. So they have those stroke symptoms, and then they completely resolve, and they go, oh, that was weird, what happened? Oh, but I feel fine now. It's important to still get to the hospital right away, because about 30% of people who have a TIA will go on to have a full-on stroke. So that could occur minutes later, a few hours later, or it could even occur 5 to 7 or 2 weeks later. But if you decide to drive someone to the hospital when they've had a TIA, what happens if you're driving down the street and they suddenly have those symptoms again? You're in the car, there's nothing you can do to help them. So even if someone has those stroke symptoms and they go away completely, it's still a good idea to call 911. Get the paramedics there because they can get fluid started. They can get oxygen on the person if they need it. There's a lot of things that they can do in the ambulance. We can have IV lines already prepared for as soon as they get to the hospital. If we need to give medicines and get them to CAT scan right away, it saves us time when they get to the hospital. So even TIAs that all the symptoms go away, it's still important to get to the hospital right away because you don't want those symptoms to come back at home or in the car. And especially if it's yourself, do not get in the car and drive yourself to the hospital because if you had a recurrence of those symptoms, that could cause an accident. With that, I want to thank everybody for joining us today. This is one of my favorite things to do, is to share information of how to prevent a stroke. And I hope you all have a good day.